Health Products Regulatory Authority has received over 2,000 reports of adverse effects experienced by people after getting the COVID-19 vaccine. The regulator has been investigating 29 of these cases that occurred after people got their vaccines to establish if there is a link to the COVID-19 vaccine. The report is expected to be released tomorrow. Dr. Nicholas Crisp, Deputy Director General at the National Department of Health, joins me now to talk about this. Dr. Crisp, good evening and thank you very much for your time. Clearly, it has been a big concern and a major contributor to vaccine hesitancy, this question of people dying after having taken the vaccine. What should we expect coming from this investigation?
Good evening and good evening to the viewers. The first thing I want to say is that South African Health Products Regulatory Authority is a very independent body, and so we will wait until they make the necessary announcements of the findings, since this is their statutory responsibility. The second thing is that we speak about adverse events, not adverse effects. Adverse events following immunization, and there are many mild adverse events that take place, and occasionally there are serious adverse events. And these are reported either through the National Institute of Communicable Diseases or through the Health Department or directly to SAHPRA, and they all end up at SAHPRA, who is responsible for what we call pharmacovigilance. And they track events following all immunizations, not just for COVID vaccines, but for all vaccines. And this has been a process that has been going on for many years in South Africa. There's a whole committee of which we call NISEC, which we will hear more from tomorrow morning when the chairperson of NISEC speaks at the minister's press briefing to explain how adverse events reporting happens and what happens after those notifications are made.
Yeah. How transparent is that process that follows after those adverse events are reported?
Well, we would like to see it completely transparent, because that's what gives people confidence in that we are following what's going on. But at the moment, the website that is to be made available to the public is not live yet. The big challenge is making sure that the very technical wording that we tend to use as health practitioners is explained properly so that the lay public can also understand what we are referring to. We tend to quote World Health Organization and scientific studies and specialists in the field quite readily as health practitioners, and doesn't mean much to the lay public. So there's been an effort together with communicators to make sure that what is going to be in the public domain is easy to understand.
Without preempting much what is going to be coming out of that report, when you speak of a number of adverse events, others that tend to be severe, do they also include death, losing your life?
Yes, absolutely. So what happens is that when a vaccination is given, whether it's a childhood vaccination given to a child or whether it's an adult vaccination given, such as the COVID vaccine is now, if there's an event that takes place that is a little bit more than just a common, sort of not feeling well for a day or two, a bit of sniffles, a bit of headache, any event, even those events can be notified. But anything more serious than that, we need to know about, so that we build up a knowledge of what does happen after vaccination. We are part of the global village, and we report all adverse events into the global reporting, so that internationally we build up a better picture of what is the prevalence and what are the kinds of side effects that are being experienced. And it definitely includes the very rare things, such as have been reported in the media from time to time, like thrombosis or clotting in the brain, and of course, deaths. So the big issue is not whether there's a death. People die from COVID and people die from other diseases they would have died from anyway. So the question is really whether the vaccine caused the death. And there will be a lot of explanation given tomorrow by the chairperson of the committee about how one goes about the standard approach to determining what we call causality.
Now, of course, when, as you mentioned, thrombosis was reported when the AstraZeneca vaccine was administered in other parts of the country, not here in South Africa, the vaccine was discontinued. Now, if indeed there are adverse findings on the Johnson & Johnson or the Pfizer vaccine, does it automatically mean discontinuation of the use of that vaccine?
No, definitely not. So, the AstraZeneca vaccine was not discontinued in South Africa because there was an adverse event or a side effect that was reported. It was discontinued because there was insufficient immune response to the particular variant that was circulating in South Africa at the time. Now that we have other variants circulating, in fact, AstraZeneca does work against the Delta variant, and there's no reason why we could not reintroduce that vaccine. One must remember that all medicines are potentially dangerous. Yeah, one must take medicines very carefully, and that's why doctors prescribe them, and that's why they are scheduled, because they can cause harm and rather than doing good. All of them, including the biologicals, such as vaccines are. So as medical practitioners, we are trained to understand what side effects can occur, how often they occur, under what circumstances one should be cautious of using a medicine, including biologicals. And sometimes there are outright contraindications to using a particular product. But when the side effects are extremely rare and the product that we are using is overwhelmingly effective, then one needs to weigh up as an individual what we are talking about. So if you do not have a vaccine and you don't build up immunity, your chances of getting infected and then getting even a severe infection, especially if you are older, and dying from that infection is thousands of times higher than getting any form of complication from the vaccine. So one does not terminate the use of a very good health product just because there may be very rare side effects.
So what do you weigh? I mean, what is the process that you undergo? I mean, if I'm understanding you correctly, that it's highly unlikely that because there were probably 25 people who would have had adverse event that the government would then decide to not continue with the vaccination program.
Sure. I mean, we've already vaccinated over 9 million vaccinations in South Africa. Over 7 million people have had vaccines. Some have had more than one because the Pfizer vaccine is a 2-dose vaccine. Out of all those 9 million vaccinations, to have had a couple of thousand reported side effects, of which some of those may not have been serious at all, and these are just adverse events where they've not even been proven to be associated or caused by the vaccine. So that's what gets investigated. And the handful that may end up being regarded as being causally linked to the vaccine, and there's a very rigorous process by which that happens, is way outweighed by 9 million people generating immunity, or 7 million people after 9 million doses being able to generate immunity and keep them out of hospital and dying from severe complications.
Now, we're seeing some report that says the Johnson & Johnson vaccine that we had in the country, a number of them could have expired, and now that date has been extended, or at least the shelf life has been extended by several weeks. Just give us clarity as to what is behind these reports.
So what happens is that, these vaccines are relatively new, and we're building up globally, we're building up knowledge about how long they last in the fridge and what temperatures they can be stored at for how long before they lose their potency and so forth. So what has happened in this case is that after the problems that were experienced in the United States, we were successful in getting 1.5 million doses of Johnson & Johnson vaccine brought in from the United States that had at that stage been thawed. So it wasn't stored as a frozen product when it was brought to South Africa. And at that stage, it was known that that vaccine could last for the period, that particular batch would last for and be potent still for the period that they registered until the 11th of August this year. Then there are further studies that continue to be done on some of those samples to ascertain whether they have remained potent, provided they're being kept in the fridge, of course. And they have been, all of ours have been kept in the fridge. And we have used nearly all of that 1.5 million doses. But rather than dump the last 50,000 or 60,000, which is what we believe was still in the various clinics and hospitals up to yesterday, rather than dump them and lose the opportunity to use those vaccines to vaccinate people, we asked whether the potency could be verified, and there are a number of other countries which have been using the same batch, and across those countries it's been verified that the vaccine is still potent, it's still effective, and we were given permission to extend it until the 27th of September. Right. This was always done as a global process because we're not the only ones buying from that batch in the world.
Deputy Director General at the National Department of Health, I appreciate your time, Dr. Crisp, and thank you very much for joining us on In Focus.